Ladies and gentlemen, join me in welcoming Team Trevan. He will be taking us through approaches to developing capacity building strategies in this effort to prevent GCBRs.
So the bad thing about speaking last in the day is that most of your ideas have already been raised during the course of the day. The good thing about speaking last in the day is you don't have to speak so much because all your ideas have already been raised during the day. So what I'm going to do is give you an overview as to the more like a framework of how we can think about the capacities we need going forward to deal with global catastrophes involving biological risks. So next slide, please. And I'm going to split this into a number of sectors. First, what is it that we need? What are the capacities that we need? Next slide, please. Generally speaking, what we're talking about is a typical emergency response type thing, but specific to potential global biological catastrophes. And so we need to look at the prevention and mitigation. We need to look at preparedness and response, and we need to look at recovery. And so there are some bundles of expertise that we need to build up in terms of our capacity to deal with global biological risks. And you can see that the prevention and mitigation both involve understanding the risks and understanding how we can either avoid them or we can reduce their impact. The preparedness and the response both have to do with infrastructure and human capacity. Whether we have the surge capacity, whether we have the ability to respond when the event happens. And then recovery, obviously similar overlap with the preparedness and response, but it's also how do we rebuild? And in that sector, we also want to start considering things like resilience. How can we build our current infrastructure so that we minimize the impact when the disaster happens? To give you an example of what that might mean from a different sector, following the Irish Republican Army attacks on the London Financial Centre in the 80s, what banks realized was that although there had been no catastrophe on that particular day from the attack, things could have been very different. If those attacks had brought down one of the big banking buildings, they would have lost all their financial transactions. They wouldn't have known who owned what, who owed what, because all of their records were in one place. As a result of that attack, international banks started developing the mirror sites for all of their electronic data about financial transactions. And the net result of that was when 9/11 happened, and those financial institutions in New York lost their big buildings, they didn't lose a second of operating capacity because they had built their mirror sites at a different location. So when you had the catastrophic event, it still didn't have the same impact as it might have done, as it undoubtedly would have done if they hadn't built that resilience into their system. So we've got to start thinking about what resilience is, as well as what recovery is going to be. So next slide, please. And if we home in, that's the planning that we do before the event. If we look at the immediate period just before the event, during the event, and after the event, we have to, as others have already said, we have to detect, we have to diagnose, We need to contain, we need to treat, we need to recover, and we need to investigate. And I think Peace this morning gave a very, very good presentation on most of these things as it regards to both the technology and equipment on the one hand, and the human capacity to use that equipment and technology on the other hand. So next slide, please. Learning. Investigation is something that we shouldn't forget about at the end of a pandemic or other global catastrophe. Catastrophes and crises are terrible events, they're tragedies, but they're also an opportunity. They are an opportunity because they've already got the attention of the public, they've got the attention of the policymakers and the people with the budgets. And they're a time when we can really get people to understand what needs to change because they felt the pain. So using a crisis to understand why the disaster happened is a very, very powerful way of getting society to learn and improve going forward to make some of the changes that are required. Next step, please. So what are the components of capacity? We've talked about the things that we need to be able to have, but within those capacities, what are the components that we need? Next slide. This comes from an American company called Alcoa. They were at one time the biggest aluminium producer in the world. They had something like 150,000 employees, and they worked safely, much more safely than virtually any other company in the sector, despite the fact that they're dealing with extremely high temperatures, molten metals and things like that. And they basically have been studied by scientists who've created this new field of organizational responses to uncertainty and high reliability organizations, they're called. These are organizations that manage extremely high levels of safety, despite the fact that they work in very, very dangerous environments. And what Alcoa came up with is the capabilities they need are obviously what some people refer to as FET, the facilities, equipment, and technology. So that is the microfluidic sensors and things like that. We do definitely need, and it's the laboratories that are capable to do the diagnostics for us. It's the research facilities that can create the next set of vaccines. So we certainly need the facilities, the physical infrastructure needs to be there. We need the processes. We need to know how to use those facilities and technologies and equipment to further the goal that we're trying to do, which is to minimize the impact of these risks. We need to train people so that they know how to use those things and to follow the processes and procedures correctly. We need to communicate all of this, and I'll talk tomorrow about communication a lot more. But within our institution, within our ministry, within our hospital, within whatever system we operate in, we need to have that clear communication, which starts with policy. What is our policy? It starts with the vision and values, and I'm very pleased to see Symbio Africa has its mission statement and its value statements. These are ways that these statements are statements that can help people to understand which direction they're headed, and so get everyone going in the right direction. So we need to communicate what is the end goal that we're trying to achieve, but also all of these components. What is the plan? What is everyone's responsibility within the plan? Who does what? Who's responsible for what? All of this has to be clearly communicated for us to maximize the benefit from the capacities that we do have. And then we need to be able to monitor the system to see whether it's doing what we think it should be doing. And we need to be measuring stuff to see that we're getting the outcomes we want and feeding that back into our learning system so that we can have continuous improvement. If we can go to the next slide. And so what this means is that we have to think of managing risks in terms of systems management. It's no good to have scattered individual efforts at reducing risk. We've got to look at the risk globally. And Robert, was it you saying that people are not looking at the risks more broadly enough? I absolutely agree with that. We need to have a very big understanding of what the risk is. We've seen from COVID that it's not just a disease-causing illness. It's a disease-causing illness which, to counteract it, we have to have social separation, which then results in economic hardship, which then results in educational hardship, mental health hardship. All of these other things come into play when you have a catastrophe. So when we think about our capacity to respond, we've got to think very broadly about all the different things that come into play. There are many instances, for example, in the UK, of the police interacting very inappropriately with citizens because they got a directive down on what social distancing was, but they didn't have a true understanding of how social distancing is beneficial. And so they would arrest people for doing things which were not actually breaking any of the social distancing rules, simply because they didn't understand the fundamental reasoning behind social distancing. So we've got to think of it as a system, and within a system, this is how we improve the plan, do, check, act cycle. This comes from the Toyota management system, which is how Toyota became the world's biggest car producer in the world. What does this mean? It means that we have to understand what the risk is that we're trying to address, have a plan to address it. We then implement the plan. We then measure the outcomes and the impacts. And if those are good, then we leave it. But if they're not quite what we expect, then we try to understand why and adapt the plan so that in the next cycle, we do the plan better. Next slide, please. And so you can see continuous improvement as being something like riding a bicycle up a hill. In the bottom circle, we do our plan, do, check, act. And through implementing the plan, we see how to improve it. And so we move up the quality improvement hill. But we don't want to slide back down the hill. So that's where standardization comes in. Once you've developed a better way of doing things, that's when we revise our SOPs. Or once we've developed better technology for doing something, that's when we introduce that better technology.